Thank you all so much for joining me today on our webinar. My name is Jaquarius Jackson. I work as a wellness advisor too on the wellness team. Today I'll be speaking with you all about kidney health. A large part about what I'll be talking about today is just really what the kidney does and why it's important to our body. The big goal of the webinar today is going to be largely to have a wide understanding about why kidney health and its function is important to us, and then what we can do in the future and right now to protect our kidneys. So just a few things we're going to learn in our session today. That very first thing, we're going to learn what the function of our kidneys are. And then second, understand what kidney disease is. That third one, just recognizing disease causes and the symptoms of kidney disease. Some of the symptoms and causes of kidney disease are just some of your everyday symptoms that can be caused by other things as well. So we want to be able to recognize specifically when some of these may be more specific to kidney disease in themselves. And then number four, of course, learn about treatment and resources, especially in the case when we can treat it when it's more of a primary thing before it does get too big. Okay, everyone, before we get started with our entire presentation today, we're going to watch a short video just explaining how the functions of the kidneys work. I primarily want to showcase this video to just really show how the actual inside of the kidneys work when we're looking at the function of them and what some of their main primary functions are. It is a very short video to watch, and then I'll explain a little bit more of some functions after the video plays.
One of the important jobs of the kidneys is to clean the blood. As blood moves through the body, it picks up extra fluid, chemicals, and waste. The kidneys separate this material from the blood. It's carried out of the body in urine. If the kidneys are unable to do this, and the condition is untreated, serious health problems result, with eventual loss of life.
As you see from watching the video, one of the large primary functions of the kidneys are to remove waste and excess fluids. As we see is that first function that's listed up there. In that same space, some additional kidney functions. So the very first big one, we know that the function of the kidneys is to help remove waste and excess fluid, which you guys were able to see in that diagram that I just shared. Outside of that, it's going to filter the blood as well. So keeping some components while removing others, because some of those components that we are going to need with the kidneys, some components we are going to need with the kidneys as it's removing some of those different things we don't need. I'll kind of go back here so you can just kind of see that picture a little bit more about what that filtration process looks like. And then I'll share after the slide after this, we'll be able to see some of those actual different organs inside, and I'll explain the functions of those also. One thing I kind of want to add on this with the functions of the kidneys, one thing I like to say, the kidneys are small, but they are mighty. We're looking at that function of the kidneys. Blood actually enters through the kidneys through an artery from the heart. And then when that blood is cleaned out, it's passing through millions of tiny blood filters as well. And we saw that with those little kind of yellow dots in that video that I just shared with you guys also. One of the main materials that's passed through kidney, as we know, is going to be urine, which is stored in our actual bladder, which we'll see on that next diagram I'll also share. Now, one really big thing and one big, huge function of the kidneys, and this is where that kidney failure may come into play yet, which we'll talk about a little bit later on, is but that process of newly clean blood returning back into that bloodstream through the way of the veins. That's probably one of the most important functions of the kidney that we want to make sure is being played out. And then we see that here in that purple function here, so controlling the production of the red blood cells. On top of that, the bladder does become full, and so when urine passes out of the body through the urethra, or just we know just simply going through the bathroom. One really cool fact I like to throw in here: the kidneys perform their sustaining job, as we know, just through that filtration process. Um, there's usually about 200 quarts of fluid every 24 hours just going through that process and through that bloodstream. And then there's about 2 quarts eliminated through our body in the form of urine. within that 24 hours, and the remaining 198 quarts is retained inside of that body. Again, just thinking about how much of our body is made up of water, about that 70%. The urine we excrete is no longer stored inside of the body for approximately 1 to 8 hours during that time frame, which again comes back into play as we'll see later on. Some of that different function of why our urine is certain colors, why we're dehydrated and unhydrated from that matter of effect. Again, going back to this very last one that we see here with that kidney function, it helps regulate the blood pressure also and the amount of certain nutrients inside of the body. And then we'll talk about what some of those more important nutrients it does keep inside of the body on our next slide also. So the relationship between the kidneys and the actual urinary tract. So as you're looking at this actual diagram here, the kidney and the urinary systems actually help the body to eliminate liquid waste, but it does keep chemicals such as potassium, sodium, and water in balance. So some facts about urine. I put a few different facts about urine there and what their colors are, and we'll see actual table on my next slide when I share it. But just some simple kind of things to pay attention to. A normal healthy urine color is going to be that pale straw color or that transparent yellow. Some things to pay a little bit more attention to for sure. That darker brownish color, it may indicate a liver problem or severe dehydration. It will not always be a liver problem. Sometimes it is just maybe that severe dehydration part. But that pinkish or red urine probably will be more of an extreme case where you may want to immediately reach out to your PCP or go to an emergency room because that may mean blood in the urine. Now, if we're looking at this diagram and kind of looking at some of the functions of the actual urinary tract, the function of the ureter. So we see these kind of strings that are coming down from the actual kidney. Their function is to carry urine from the kidneys down to the bladder, which you see that kind of connection point there. About every 10 to 15 seconds, small amounts of urine are actually emptied out into the bladder from the ureter. Now, to this same point, once the ureter reaches the bladder, um, all the urine is stored there. The bladder actually stores up to 2 cups of urine for about 2 to 5 hours. If you guys want a fun fact there, dogs store about 0.5 to 1 cup per hour per 10 pounds for a dog. And they can hold for about 8 to 10 hours. And if you have one, you probably know they can hold even longer than that sometimes. After that, urine is actually excreted through the urethra. And then from that point, urine passes out throughout the body and is signaled through the brain. So the brain is actually signaling the body whenever to use the restroom at that point in time. So the next slide here, this is just kind of like a hydration chart, and I think this is kind of a really fun way to show hydration. It's showing hydration from the basis of actual hydration points using fun things like lemonade and light beer. So as we see here, transparent means you can actually be overhydrated sometimes. So when you actually see your urine as actually a super clear color, you're at that overhydration point. So maybe just hold off on drinking a little bit more at that point in time. Maybe just hold off on having a cup of water or something like that, because you are well hydrated, so we can stop drinking for just moments at that point in time. The lemonade color, that's optimal hydration, whatever we're doing. If we're have our big jug of water and we told ourselves, hey, I'm gonna drink 8 ounces every hour, whatever the case is at that point, keep that cadence going. I use that as a really good example. I think one of the best ways to keep a healthy balance of your hydration is to set some type of mechanism within yourself about how often you want to consume your beverages. I like to keep like a little 16-ounce like shaker bottle with me during my workday. And I like to make sure I finish the 16 ounces at least every 2 hours and refill it as my day goes along. And that's how I like to keep my water balance going for myself. I know some people like to set reminders on their phone. I've heard of people utilizing this like plant app on their phone that every time they drink something, they log it on the phone and it helps their plant grow inside of the app. So I know people get really, really creative when it comes to what their water intake looks like and how they choose to log it. But whatever it is, the best way to make sure you're keeping optimal hydration, make sure you're keeping it on some type of schedule. Going back to our hydration chart, light beer, so you're still hydrated, want to keep going, keep doing great still there. Where it does get a little bit more, they want to pay a little bit more attention are those amber and that burnt orange color. We see at burnt orange, we are definitely hydrated and want to start to consume lots of liquids, and even at that amber color as well. One thing I want to do point out at burnt orange, it says you're definitely hydrated. You want to drink lots of water and electrolytes. Some quick ways you can get electrolytes are typically by like Gatorade or something like that. And that's just putting some just kind of extra like quick sugars and things like that inside of your body. It's one of the easier ways that I think you can get some electrolytes inside of your body. I know nowadays they have quick, easier things like those liquid IV packets and things like that. But again, when you're reaching out to different resources like that, it is always good to consult your doctor about them as well to see if it is a good alternative for you. So next, getting into the actual aspect of what is kidney disease. So we talked about the function of the kidneys, and then what some of those different functions are about the different organs inside of the urinary tract. So next we'll actually discuss what is kidney disease and what some of the different kidney diseases are as well. So over the next two slides I'll share with you, it'll be quite a bit of different information. So when it comes to kidney disease, which is also called kidney failure, it can actually break down into six different categories. And I broke them down into three and three over the next two slides that I'll show you. So again, kidney disease, also referred to as kidney failure, is just simply a loss of your kidney function. In chronic cases, dangerous levels of fluid and waste build up in the body. Going back once again to what the function of the kidney is, to excrete waste. When it comes to kidney failure, slash kidney disease, that waste that we want to get outside of the body, isn't getting out the body the way that we want. We saw that we want potassium, sodium, water, to be balanced inside of the body. Those three things aren't being balanced inside of the body properly, which can lead directly to that kidney failure. So we see three different types of kidney disease here, and I'll kind of give you guys a little bit of time to read through all of those. I won't directly kind of go through them, but some words on there that I want to kind of point out a little bit. So pre-renal, and then intrinsic. So that word pre-renal, it actually means occurring in the circulatory system before the kidney is reached. So when we see acute pre-renal kidney failure, so it's actually happened before it actually reaches the kidneys. So we'll kind of go through that one a little bit. Insufficient blood flow to the kidneys can cause acute pre-renal kidney failure. Doctors can usually cure this type once they determine the cause of the decreased blood flow. The reason I kind of point this one out and kind of focused on that pre-renal word a little bit, because though this is occurring in the kidney, it's occurring before it actually reaches the kidney. So this insufficient blood flow is actually occurring before it actually reaches the kidney in itself, which is where the occurrence of the kidney failure or slash kidney disease is actually happening at. Luckily, as we see there, this is something that doctors can usually kind of determine the cause of, where that decreased blood flow is coming up, and there may be some type of resolution for it. When in here we see those same words again. The last two on here are a little bit different. We see a chronic post-renal kidney failure and then acute post-renal kidney failure. A little bit different from what we saw last time. We saw last time pre-renal, and then this time with post-renal. So this is actually occurring after. So going through again the same process. Chronic postrenal, so a long-term blockage of the urinary tract prevents urination. So this causes pressure and eventually kidney damage. So that blockage of the urinary tract is actually causing kidney damage. So this is actually happening after a long-term event of something that's already occurred beforehand. The same thing with the acute post-renal kidney failure. This type of kidney failure can occur due to stones or another blockage. So we see with these two things when it comes to the post-renal kidney failure, we see these two issues typically are occurring or causing kidney failure due to something that's happened over a long term of time. of the kidneys. We talked about now 6 different kidney diseases. But then those 2 words that we'll really look out for, either intrinsic. Now we see post-renal, pre-renal kidney failure as well. So what are some things we're looking for when it comes to kidney failure? So these are the top 3 signs in early signs of kidney failure. Again, also referred to as kidney disease. And these 3 signs that you'll see here, these 3 signs can be pretty general to many different things that you see here. The first one that I want to talk about a little bit is dizziness and fatigue. Now, dizziness and fatigue comes about when kidney failure due to a buildup of toxins in the blood. Dizziness and fatigue largely comes about because of anemia, which is linked usually to kidney problems. Now, for most of us, we can just get unusually tired or just tired throughout the day, or you're like, hey, it's been a long week. I'm just tired as it is. You don't want to typically panic in those situations. Those can just be due to stress or overworking or just day-to-day issues. We do want to kind of pay attention to those times. Maybe we're more tired than usual, or it's been 2 or 3 weeks and we just feel like we can't get enough rest as it is, or we're finding ourselves dizzy. Dizziness is coming about within that fatigue as well. That may be a point in time that we want to consult with our physician immediately, just to kind of explain what that's look like. Another one on here, so swelling in our limbs. So this is often caused by an electrolyte imbalance or other nutritional abnormalities that will affect the filtration process. So I talked a little bit earlier about the color of urine, and sometimes when we are dehydrated, that we just want electrolytes in the body. Well, swelling can also cause that if we are not getting enough of those. And I did mention one super easy kind of trick or hack that we can use by getting those. Is one way, just getting like a quick Gatorade in, or like some of those liquid IV packets, but again, utilizing those, maybe consult your doctor first. Usually lower extremity swelling is a sign of heart disease or kidney disease, or just any type of poor form of circulation. Also, lower extremity also affects people with diabetes. So again, I mentioned that some of these early signs can affect people of large different parts of groups, but it is something we do want to pay large attention to. The last one there, we talked about this quite a bit already, but decreased urine output. That's just kind of a straightforward one there. I talked about it earlier and quite a bit, but if that filtration process isn't working properly, kidney failure can occur and cause decreased urine output, as well as we've seen already in our diagram, discoloration in it also. Um, so now that we so now that we know the signs, what are my risks and where do I fall within that risk category? So the main risk factors when it comes to kidney failure or kidney disease is really just having another high risk cardiovascular disease in itself also. Diabetes, high blood pressure, heart disease, or obesity. And then going back really fast to this early signs of kidney failure, all of these early signs of kidney failure, when we're looking at these main risk factors, all of those early signs and these main risk factors are early signs of all of those as well, also, which is a really good example about the correlation between the main risk factors of and risk of kidney disease, how those all tie with each other. Some additional risk factors: prolonged use of NSAIDs. So we think about Tylenol, different things like that. Having autoimmune disease, chronic UTI, so getting them really often, and or kidney stones, which we know can cause like some of that dizziness and fatigue also. And then uncontrollable risk factors. So these are just simply things that we can't change at all. Family history, being 60 and older, and then low birth rate. I gave kind of that diagram, looking at your urine a little bit more, but pay just a little bit more attention to some of those early signs. And then when it comes to family history, you just can definitely have a lot more of those conversations with your doctor and get some of those different testings done for kidney disease, which I'll talk about in some of the later slides. National Kidney Foundation, you can actually find a kind of at-risk assessment. And one thing I really like about this at-risk quiz is that at the very end, it'll tell you if you are or are not at risk, and then why, just simply based off the answers that you pick. And so I will just kind of go through here and just kind of randomly pick a few answers. And it's a very quick quiz that you can go through. So have you ever been told by a doctor that you have any of the following? I'm going to kind of kid around here and say I have high blood pressure and prediabetes. Has anyone in your family history play a role? I'm going to say no. My race and ethnicity, Black, African American. And then weight plays a role in your risk for kidney disease. How would I describe myself? I'll say slightly overweight here. And then my gender is a male. Last question, age, 35 or younger. And then results, I don't want results emailed to me at this moment. So super easy quiz. I just took it in under 30 seconds. Now from here, so this quiz tells me I am at risk for kidney disease. Early detection and treatment slows the progression of it, but one thing I love about this, it helps me to understand my results. So why am I at risk for kidney disease? The reason I'm at risk is because I have two of the most common risk factors. So the first one, diabetes, is a major cause of kidney disease, which I mentioned that I may be pre-diabetic. And then number two, high blood pressure or hypertension is a major cause too, which I did mention I have that. One thing I did point out is my race. So Black or African American, it said they may be at an increased risk also. So this is a really good quiz that you can also do at home in your spare time and just put in some of your results that are more true to you, to understand where you fall along those lines. And it will give you an explanation also for why you may be at risk if you are. When it comes to testing for kidney function, another way that you can provide testing is utilizing the GFR. The GFR is a blood test that shows how well your kidneys are working. Typically, the GFR is going to be a number based on the amount of creatine that is in your blood. Some of you guys, if you may work out at the gym often, you may have heard of the word creatine before. To break down what creatine is, it's just simply a waste product that comes from utilizing your muscles. You may have heard some people utilizing creatine at the gym to provide more muscles or to gain more weight when they're at the gym. All creatine does is hold more water inside of the muscles whenever you're working out. But for most people, your body already naturally produces it. People who are more muscular naturally produce more creatine and have natural levels of higher creatine as it is as well. Now, healthy kidneys are going to filter out more creatine out of your body. So you were looking at that GR when you're looking at that GFR and your results of it. Typically, a higher number of that is going to be or more of your mild kidney levels, and more of that lower number is going to represent more of like a stage five of some of those kidney functions. So we are looking at when it comes to your testing for your GFR, we do want it to be on that higher number of a scale. Standardly stage four, it is going to mean that you have a GFR between 15 and 29, and then moderate to severe damage to your kidneys. That's going to mean your kidneys are not working as well, and they aren't filtering out waste as you want them to. That waste can build up in your body and cause other health problems such as high blood pressure, bone disease, and heart disease. Now, you may have some of those symptoms that we discussed earlier in our session, such as swelling of your hands and feet. And you may even have pain in your lower back as well. Stage four will be the last stage before you reach actual kidney failure. So it is really important to make sure you have regular visits with your primary care provider to make sure you're taking the correct steps to slow down that kidney damage as much as possible, to make sure we aren't reaching that actual stage of kidney failure. Now, outside of just our standard GFR testing, you can do a normal blood test when it comes to testing for kidney function. Then outside of blood testing, our standard urine test is going to analyze a sample of your urine to reveal any abnormalities as well. Some doctors may encourage doing some type of imaging test, just to assess the size and the structure of your kidneys to see if there are any differences between those. And then in extreme cases, you may have to get a sample of your kidney removed to test for the tissues there. Your doctor may need to get a biopsy of your kidney, which is going to revolve even removing a piece of it. But local anesthesia is provided there in the case you have to get that done. Again, this is why we really suggest for you to have those conversations with your primary care provider, see what is going to be the best testing option for you. But we'll talk about some treatment options if you do find that you have kidney failure or some of these more extreme cases of stage 4 or 5 kidney disease. So now you found out you have kidney disease. What does the treatment of that look like? The very first one, if you do have more of a mild case of kidney disease, lifestyle changes will mainly be implemented, and it will be the first kind of treatment there to delay any progression of kidney disease. Some of those lifestyle changes will just largely include just having a better diet, not smoking, and different things like that we know to do on a day to day. Doctors will also work with you to treat some of what those different complications are. So if you have high blood pressure, swelling, if you're anemic, most of those would just be treated through medications. If you do have a more extreme case, we may go a little bit more into the cases of treating your kidney disease with dialysis and or a kidney transplant. Dialysis actually artificially removes waste products and any extra fluids from your body when your kidneys are no able to do so. It's just a machine that actually filters the waste and your ex fluids from your blood. Now, the actual kidney transplant, so it's actual surgery. The kidney transplant involves surgically placing a healthy kidney from one donor into your body. Transplanted kidneys can come from deceased or living donors also. Now, after your transplant, you will need to take medications for the rest of your life to keep your body from rejecting the new organ, and you will not need to be on dialysis to have a kidney transplant. So those are just a few things to keep in mind. Diets such as a low protein diet may also be recommended as well, and that's just in regards to make sure you're watching your creatine levels, like we kind of mentioned when it comes to that testing aspect. Kidney health. So the first big one, so knowing the facts. So what are the facts? 3% of adults in the United States are actually at risk for kidney disease, which if we think about it, that's about 1 in 3 people. Kidney disease is actually a major public health concern, and a lot of people go undetected until it is really advanced or more that chronic disease state. But unfortunately, that's when people typically need to get dialysis or a kidney transplant. One way you can protect it though is by assessing your risk, and we saw what some of those different things are. Having some of those other chronic diseases like diabetes, high blood pressure, heart disease, things like that. But then also recognizing your symptoms. We talked about some of those early signs of swelling in your limbs, dizziness and fatigue, or decreased urine output. And then getting tested. We know you can get that GFR done, but some of that simple testing also is just making sure you're monitoring your blood pressure. And then just lastly, staying healthy and learning more. Some different ways of staying healthy and learning more are just largely those things we should already be doing and everything you should do. Make sure you're controlling your weight, exercising and dieting properly, not smoking and just drinking in moderation. Some things that are a little bit more specific to kidney disease in themselves, staying hydrated. I gave some of those ways that I like to stay hydrated for myself earlier. And some of those other ways I've heard that people like to stay hydrated themselves, using the Plint app, logging their hydration there, walking around with a jug of water all day, marking the times a day that they want to complete drinking a certain amount of water, but also monitoring your cholesterol and just knowing what your family medical history is if you do happen to have a family medical history of kidney disease also. So kind of tying things up here, there are some resources within the Baylor Scott resource and plan that you guys can also connect with. One really great one I think you'd always connect with is the BSW app. This is a great place that you can always manage your care and stay connected to your medical team. Again, just asking some of those different questions or setting those appointments up with your doctor. And again, getting some of those different testing done, right? This is a great space where you can go and be able to actually see some of those different results. Also shared with you some of that different quiz that we took. You can actually find it at www.kidney.org, where you can find that at-risk quiz, as well as a lot of this different information that I shared with you today as well. I really want to thank you all for taking the time to listen to my webinar today. And just again, encouraging you to take care of your kidneys. Again, one of the best ways we can do so, just knowing your family history, make sure we're getting our testing done. As a reminder, make sure you're checking your blood pressure, and just making sure that we're consuming our water and staying hydrated. Thank you all for again joining me, and I hope to see you all at our webinar again next month.